afternoon, or whatever part of the state it is. Good morning or good afternoon. Council Lady LaShawn, can you believe it's here again?
It seems like we were just here yesterday. Right?
It's unbelievable.
Yes.
And I just want to say this is a continuing moment of Black history here in our great city of Douglasville. And our guest today, Council Lady.
I tell you, I am Councilwoman Dr. LaShawn Burr-Danley. Councilman Davis and I, we serve in the same ward, Ward 3. I am Post 1, and Councilman Davis is...
Post 2.
Are you Post 2 or
Post
Post
3.
1? We've been here for so long, I can't remember. Anyway, we are Ward 3, the New Horizons, and today, another year of continuing moments with Black history. And our guest today, we're focusing on health. Councilman Davis, will you please introduce our guest?
I let them introduce individually because I tell you, I am excited and it never amazed me. I just been smiling.
Awesome.
And our first guest today.
So give us about a minute or two introducing yourself.
Sure. My name is LaShawna Arrington. I am a registered nurse. I do IT currently. Left the bedside in 2012, and now I configure the medical record software for nurses, doctors, clinicians, and also co-owner of Tito's Lounge in downtown Douglasville.
All right.
Wow.
Okay. Thank you for being with us.
I'm Sheila Taylor, also a registered nurse, and Shauna and I used to work together at the bedside. I left the bedside last Friday. I turned in my retirement notice.
Congratulations.
Congratulations, yes.
So, but I've been in critical care, home health, and now I have a wellness center also that is out there to help the community.
Wonderful. All right. And who do we have?
Oh, the legendary.
Legend.
I'm Dr. Kelvin Burton. I practice at Total Care Family Medicine here in Douglasville, Georgia, off of Fairburn Road. I've been practicing in Douglasville since 2004 and in the West Georgia area since 1995. I've done, right now my practice is primarily primary care and family practice, but we also have a sub-interest in pain medicine as well as cosmetic medicine. So we do that gamut. So I've done quite a few things, been over some ICUs and emergency rooms, but
Wow.
I've long since left that and came to the mild side, if you will.
The wild side.
Dr. Burton, I tell you, I am so thankful to have you all out on a beautiful day. And let's start with a little history growing up. And let's start with Shauna. Can I call you Shauna?
Absolutely.
Thank you. Let's start with Shauna, you growing up, and what encouraged you to go into the healthcare field?
Yeah, so growing up, I was always a nurturer. What my mom would say is I always wanted to take care of my grandma. And so she knew from then that I was going to be destined for healthcare. And so it was just, as I grew up, I just said, you know what, I want to become a nurse. And everything that I did, focused on me going to nursing school. And went to nursing school in Greenwood, South Carolina, became a travel nurse, and then settled in Atlanta, Georgia, and started working in the ICUs, the ERs, all out here.
Summit Hospital, I bet number one was Grady.
Oh, yeah, you already know. I was in the trenches in Grady. I was in the ER. Yeah.
Great place
That's
to be.
where you get your burning and training.
Mm-hmm. Yep.
Wow. Well, thank you and congratulations that you love what you do.
I do. I love it.
Awesome.
Okay, and Miss Sheila.
And I just want to say that excellent nurse. I would have her care for me any day.
Thank you.
In either setting. And she helps me with IT as well, because I'm not good at
Computer.
But same story, basically, as far as our grandparents. My grandmother, she was the babysitter, but I always felt like I was caring for her 6, 7 years of age. She went to the hospital one day, and because I was a minor, I wasn't able to visit. Those were the rules back then. And one day we got that call that she passed, and it devastated me. And I decided that day I'm going to be a nurse so that no one else has this experience. And even to this day before I retired, when people, especially during COVID, people were, dying by themselves and alone, no family there. I was holding that hand and singing that song, Going Up Yonder or Take Me to the King, whatever was necessary to let them know it was okay to transition and that they weren't alone. So I love being a nurse. It's gonna be hard, not being at the bedside, but I do love healthcare, and I love nursing. Not sure about healthcare, but I love nursing.
That's great.
Yeah.
Beautiful story.
Yes, it is.
So, have you and Shauna ever worked together at Grady's?
No, we didn't do Grady together. No.
Okay.
But I have a lot of colleagues and friends, in addition to Shauna, that have worked. Grady's a great place.
Good.
You're definitely going to learn there and
Yes.
work hard. And, it may have a reputation, but they're going to save your life over there.
That's awesome.
Oh, absolutely.
They're going to
Okay.
save your
Absolutely.
life.
So, Dr. Burton, tell us a little bit about how your interest in becoming a doctor. What inspired you?
Probably my biggest influence. Well, I had a couple of influences. One was that we had a family business. It was in construction, actually subcontracting and concrete. And from a little child, my grandfather owned this business. My uncles were all involved in that business. And from the time that I can remember, maybe 7, 8 years old, I was out there working with them. They would take me with them to work.
Wow.
But as those who are in construction and contractors know, it is hard work. So when I graduated from high school, I said, I don't want to do this anymore. So I've got to do something that's not going to require such physical labor. And then the next biggest influence became my mother. She said, well, what do you want to do? What do you want to study? And I said, I want to go into singing and acting and theater. And she said, okay, that's good. She said, and I said, so what's my allowance going to be? I'm talking about when I got into college. She said, well, there's a lot of starving actors and a lot of starving singers and things out there. I mean, she said, son, you're talented. You could do these things, but I'm not going to give you any allowance. I said, well, Mama, how does medicine sound? She said, well, now you can get an allowance. So that was probably my biggest influence as far as things are concerned. And I went into a pre-medicine program over at Morehouse College and went on from there to become a physician.
Great.
Yeah.
So, was there any, Dr. Bringworth, as going into these schools, now this is Black History Month,
Yes, sir.
did you have any kind of disruption while you was trying to get into your profession as you went to school? Was there any? What was the ratio of black young men and women that was?
So in medical school, I remember I went to medical school at the University of Iowa School of Medicine. Applied there after my junior year in college and actually got in, but I waited to go ahead and graduate. I did not want to go in after my junior year. But in my class, there were probably 15 minorities out of 150 students, and about 7 of those were black. So if you just do the numbers, that's about 5%. Well, as a population, we're probably around 10 to 15% of the the U.S. population. So certainly an underrepresentation there. I can also remember challenges even in high school. Even though there were some achievements that were made, just couldn't get to that top. But there were reasons why, and I don't even want to go into it because it served to motivate me.
Right.
It served to motivate me when our colleagues were given scores and things that happened to be better. I'm talking about the subjective ones, but when it came to the SAT and the national scores, I was on top of my school. So that sort of thing. But valedictorian and salutatorian, those sorts of things kind of slipped away from me, and that's okay. Because like I said, it served to motivate me. And again, my mother was there, and she was like, "Don't worry, son, I got you." I can remember one time that how they give you all the trophies and things for sports and different things like that. And my mother brought me home one day. She said, "Well, you made A's in this class, so here's you a trophy."
Aw.
And I thought that motivated me. But I played sports too. Now I was good at basketball. You can go right to that little town in Temple, Georgia, and see that I'm still my pictures on that basketball wall and things like that. But certainly, mother and father both big influences with my educational track.
That's great. And you can sing. Notice I didn't say sing. You can sing.
Our next play.
Yes.
Right.
Yeah, we do. We'll talk about it.
Okay.
So let's talk a little bit
Put you
about
in
COVID over the last 2 years. And of course, COVID's not going to go away. But over the last, I would say, from 2019, 2022, all of you were in the health field, where although you were in technology, you were bedside, you were in the trenches right there, all of you. So let's just focus on down to COVID and African Americans, blacks. Just from my experience in my own household, as an adult my age, I didn't have an issue with being vaccinated. However, I noticed that in my own family, those between the ages of 18 and 35, I would say they're the ones in my family who did not want to be vaccinated for several reasons. We talked about it. A lot of it was what happened with the Tuskegee, that, and just I think other information was education. The shot hasn't been out long enough. Tell us what was your dilemma or your challenge with people, specifically African Americans, during that time.
So I would say for me, working in technology and also administering the vaccines with Tito's Lounge, what I heard a lot is why are you giving it, or why are you taking the shot? And it was a matter of people not understanding. It was just a lack of knowledge, preconceived notions, like you said, with the Tuskegee Airmen. So just a lot of people just didn't understand and was closed-minded and not being open-minded enough to want to take in information. Even if it was a minimal amount of information, it was something that we can give you to say, okay, this is the reason why. But a lot of people just want to shut it out and say no, and have their preconceived notions. So we experience it a lot.
But I think it helped when Shauna and I were giving shots, because we were helping, thanks to Councilman Sam.
Let me stop you right there.
No, I remember that.
Let's go where
I
it
remember
started.
that. That was great.
I tell you, I got so many phone calls. They couldn't get registered. They couldn't get in. It was full. They weren't taking anything. I went to the local mom and pop pharmacy. Then I came back to Tito Lounge. Shauna and her husband were sitting in the office, and I told them my plan. The husband said, "Let's do it."
That's right.
Brian over at the Mom and Pop Premier, he said, "Let's start it in 2 days." In 2 days, I told him I'd get on the streets. I got out on the streets, and Dr. Brady, you probably had people saying that they see it.
I was sending them over there.
Really?
I have a relationship with Premier now as a result of that.
That's
Yes.
awesome.
And I tell you, when Dr. Collier, he'll be coming up soon, and then we got the state came in on us, Dr. Burton. They come out and they asked me for my ID, and I give them my ID. Then they went on in. They come back out and said, "Oh my God."
So Councilman Davis, let me back up, and I do see you. So you mentioned, and we were talking about this earlier a little bit offline, and we all agreed that we wanted to move forward with it. So Councilman Davis, did you see in our community that there was a lack of education for there was education out there, but for African Americans taking it and receiving and believing it. I don't blame anyone for making the choice of whether they want to be vaccinated or not. That's their choice. However, there have been many stumbling blocks for African Americans as it relates to health care, obtaining Medicaid access. So in our community, are you saying that there was a limited amount of vaccines being administered in our ward, or just to
You
African
know,
Americans
out there
in
on that
general?
streets, they was coming in so fast and lining up, and I could not tell who was who because I was working on getting people in, truck drivers, UPS drivers, all of them. I said, pull the truck over. Mr. UPS said it's okay to come in and get a shot. When the health department came, they went in and seen those two with their ID and credentials. They came out and said, this is awesome.
Because it was very difficult in the beginning when that vaccine first came out
Right.
for people to find where you can be
We
vaccinated.
were
Because
given
I
it
remember
before Walmart, Walgreens, and any of them. I'm telling you.
you were given it prior
We
to.
were given it at Tito's, thanks to
And
that,
then Dr.
Councilman's.
Burton,
Yeah.
in your practice, were you all allowed, or were you able to literally administer the vaccine?
It was very difficult to apply and even get it. So we stopped trying, especially when the large pharmacies and small pharmacies were able to get the vaccines and bill and so on and so forth. People were afraid to come to doctors' offices even during that time, thinking that they would get sick.
Right.
That's right.
That made a difference in a lot of ways. Our census obviously went way down because people just did not want to come. And then when they got sick, the first place to go was the emergency room. The probably biggest challenge that I had with clients was, and they've already, my colleagues have already alluded to it, was the misinformation. That internet was, is sometimes the worst enemy because we believe things that are said there, but they come from non-reputable sources. They don't come from good sources. We have to again educate and do the research and for ourselves. But to quote Bible, because it is a book of wisdom as well.
Yeah.
It says, "My people perish for lack
of
of
knowledge."
knowledge." That's one thing, and I would always give the example of Moses. We know the story of Moses, how he led the Israelites out of Egypt, and but that last plague was where they had to put the blood on the door to keep let the death angel go and pass over them, so that their firstborn would not be killed. And I correlated that to this. I said, God has given us something here to help or assist the death angel to pass us. Why are we not willing to take something that God has given us?
Faith without works.
Exactly. So that was my correlation. I tried to help people understand that, you say, you're using cell phones now. You're using MP3 players and Bluetooth and all of that. And that was how the vaccine was developed so quickly. We used the computers. So you can use your computers for this. You can use your cell phones and your Bluetooth for that. But now that in medicine we've developed something more quickly than before, because it took a long time to do vaccines because they were grown. You had to grow them, and this process took years of study. But the computers did it for us, so that's how they were able to get it quickly.
But wouldn't you say too, and I agree with everything that you've said, education, the lack of knowledge, fear, but wouldn't you say too, as an African American person, that there have been a lot of areas where we have not had access? Currently, right now in Georgia, with Medicaid not being expanded, there's about 600,000. There will be about 600,000 individuals without health care.
You don't want me to get on my
So
soapbox.
if you've never had health care, I've been in a place at one point in my life where I didn't have health care. That is very scary. And when you have children and you cannot find a place, a relative right now, one of my relatives has Medicare. And, of course, Dr. Burton, bless you, with the way insurance companies, one year you have them, the next year you may not contract with them. So the distance that individuals have to travel to go to find a doctor or a therapist or a specialist that specialize or even accept their insurance may be miles and miles away. And considering we don't have MARTA here, so there's a lot of limit to transportation. So we, as African Americans, have been on the bottom of the totem pole a lot of times. What would you tell individuals today dealing with COVID misunderstanding, where would be the first place that you would encourage them to go to a trusting place where they can get information? Dr. Burton, let's start with you.
Sure. The first thing is I don't understand. I still to this day, and maybe you all that are in the have a tendency to be in the political environment can enlighten me. But I still to this day do not understand why Georgia or any state would not have accepted expanded, Medicaid. I just don't understand that decision, other than it being political, and also, the mindset of healthcare being a privilege versus a right. And I'm on the right side. Well, it is the right side. It's a right as far as I'm concerned. As far as things are concerned, again, it becomes educating yourself, finding out where are these places that are friendly to those who may not have insurance, because they're out there. It's just a matter of finding them. But we use our computers and cell phones for everything else. We can Google anything. So when you say, places for uninsured, and you Google that into your phone, boom, many things are going to pop up. But is that your priority? Are you concerned about your own health? And that's an area that we have to, again, inspire and teach and educate and go through, whether it be our schools, whether it be our pulpits, whatever, for people to take care of themselves.
So you're saying, Dr. Burton, that the information is out there.
It's out there.
You can research and find it. It's just a matter of being consistent. Is that what you're saying? Being consistent,
being concerned,
okay,
and being interested.
And it's okay to say I don't know.
Exactly.
Understand.
I mean, when and especially for our young people, when you're feeling good, young and feeling good, you're feeling invincible, like nothing's ever going to happen to me. But those are the years where now, when you get to the age of someone like myself, you wish you had done something back then, because now you're feeling, unhealthy or something like that. Many times that background was set in your younger years because of certain habits and behaviors that you may have taken on.
That is correct. Comments?
I would agree with our colleague here on accessing the computer for different things. Because I see what happens is people are utilizing urgent cares and emergency rooms instead, which is just going to give you a one-shot, quick fix type scenario.
Perfect
and
point.
Not follow maybe your chronic condition, or educate you. So I think navigation also is an issue. So once you have found that clinic, because there's a lot of free clinics, every county has one or two, then it's not a bad idea to take someone along with you that can help you navigate through that system, to explain when you say, I'll ask someone, so what medication are you taking? I'm good. My doctor has me. Okay, so what are they for? I don't know, but I'm taking this blue one for this, yellow for that. But they really don't know the side effects, the food-drug interactions, why they're taking it, what happens if you miss a dose, And so there's so much information that if you're with the right providers, you can get on the right track, especially because disparities are real.
That is correct.
It is real.
Oh, yes,
you go in the hospital. I remember working in the emergency room back in Florida, and the one person may come in with complaining. One female may come in complaining of abdominal pain, and they're running up, checking for every little thing, that might be going on. And if an African-American female put them in the gynae room, it might be gonorrhea, probably some kind of STD. And I lived that.
Oh,
I
yes.
lived
So
that.
why
Come on.
So why is that? Just from your
a lot of it is
experience, why?
judgment and preconceived ideas that people have about us as a people.
Yes.
But once they're informed and spend time, and understand, and then another sickle cell. Oh, they just want pain meds. Well, they're in pain.
Right. It's true.
And so there's a lot of, my hot spot is organ donation, because some of these influencers on social media know what they're doing. It's a strategy. If I tell them this, they won't get the vaccine, and then they will perish, just like he said in the Bible. Don't become an organ donor because it's gonna, they're gonna. There's so many myths that people tend to fall for, and they take that 1% of something that happened to one or two people and use that as opposed to the millions of people that things have saved. Right. So I don't get into that conversation with people. We have the vaccine if you want it. And when Shauna and I were given vaccines, we were able to help people see that, well, if they're, because they would ask us, so you vaccinated? Right. Yes. Mm-hmm. Initially, I was afraid because I have a hospital condition, pre-existing condition. Mm-hmm. But then I felt like I'm going out working in a hospital. It's like a police officer going to a gunfight without a bulletproof vest on. Mm-hmm. I had to vaccinate myself. The physicians told me I was safe, and I had to, do that and walk out on faith, and I've been fine. I'm mega vaxxed. But once they knew that, them two sisters got it, so then we would see them going off, come down here, come down here. So they saw someone that you don't have to wait online. You're not going to be judged. You're not going to be asked a bunch of questions. And, so we were able to comfort people into feeling safe to get the vaccine. Mm-hmm.
Did you have a comment?
I'm very proud of that.
Yeah, pretty much just to piggyback off of what they said, you have to be an advocate basically for yourself. You have to want to learn. You have to seek out information. You can't allow or just, I'm just going to wait and see what they bring out and then it falls into your lap. You have to go out and, each one teach one and seek. Yes. So this, same thing. Research. The information is out there. It's readily available. You can Google it. Journals are available now. People can just look at medical literature and Google and YouTube. You can be a doctor on YouTube basically. So, you can basically, the information is there for people to get what they need.
Councilman Davis, you have any other questions?
My question was, Dr. Braden, when you heard that slogan say "shot for a shot," what did you say, Dr. Braden? Oh. Shot for a shot.
I didn't hear that. You're gonna have to educate me real quick. When we
opened up the lounge with Premier for COVID shot,
yes, sir.
The slogan was "shot for a shot." Come in and get a COVID shot. You get a shot at the bar.
Oh yeah. Now
it took off. CNN, all the TV station was out there want to know how to go about ministering a shot for a shot at a local bar. And those two young ladies right there, I owe them tremendously.
But to be
honest, no one hardly took advantage of the shot for a shot. They just wanted the vaccine.
You happened to use the space that was a lounge. So, but you were not administering shots. Immunizations, you were administering COVID. You weren't administering alcohol.
Right.
So it was just... So those that maybe
it was just a catchy phrase, because we're at a lounge and shot for a shot. Yeah.
And they come in and they peep in, they look, but they came from all these different cities because they couldn't get appointments.
How many would you say you vaccinated?
Ooh, hundreds.
Yeah,
hundreds.
Because we did it. Was it every day? We started at 10 in the morning to we opened the lounge opened at 4, so we did it up until we opened. And we got pictures where they were up at Gumbo's. The line was just that long of people coming in because. Again, like you said, accessibility. They now had the accessibility to come in a neutral place in their backyard. Yeah,
and they would call other people.
Yeah, they would call. There's no line. They would be on Facebook. Women in Douglasville. Awesome. There's no line. Go down to Tito's Lounge. So
I'm sorry. And that slogan, now that I understand I think it's ingenious in the sense that it may reach a faction of population that might not otherwise seek any sort of care. People who are knowledgeable or research or wanted it, you didn't have to have fancy slogans and things. But those people, people sometimes want to get something, even though it's doing something good for them themselves, to have something else there to maybe relax you or something.
And we're very grateful to
we're leaving those barriers.
Yeah, we're very grateful to Dr. Miramar, who's the director of Cobb Douglas Public Health, so they were able to put together a team and give immunizations for COVID at Golden. And then also they had some at Willie Watkins. It was actually after the start of Councilman Davis pushing Premier Drugs and what you all did at Tito's. Thank you so much.
Thank you.
So, ladies, what would you all inspire other young people, male or female, to become healthcare or get in the medical field?
I would encourage, but you have to have a passion for it. You can't just go in, because a lot of times you go in, you get burnt out. It's an easily burnt out field, so you can't go in with that notion, oh, I'm going to make money, or it's going to be cutesy or anything. You're working, it's hard work. You definitely have to have a passion for taking care of patients and taking care of those patients as you would want your family member or you to be taken care of. You have to. It's not for the weary, the weak. You have to really want to do.
It's to be a calling.
Absolutely, it has to be a calling. Yeah.
Awesome.
Okay. Ms. Sheila?
It should be a calling. Unfortunately, it's not necessarily for some of the individuals that are coming into the field now. Thinking, like Shauna said, it's a quick way to make money, and have different perks. During COVID, the doors were wide open, come to Hawaii for 13 weeks and then New York City, and people did go, and some people didn't make it back because of COVID. Some people passed, or some people, but there, you had to, I'm asking anybody going into nursing, healthcare, be patient, love what you do, care for the people that you're caring for, because it could be you or your loved one on the other side of that exam room table. And so that's what I would say and encourage. If not, go do something in mechanics, electricity, plumbing. They pay well too. Because when I need healthcare, I want somebody that's going to be taking the time, not non-judgmental, and really advocating for me, going the extra mile, singing with me if I need to be sung to.
All right. I love it. Come back off of retirement.
No, she said come back out of retirement.
So, Dr. Burton, what's your take on all this?
Well, I guess I'm piggybacking on what they said, but certainly you got to realize healthcare on the surface seems very glamorous. It's a great thing. I'm going into healthcare. That it's not as glamorous as it looks, or as it sounds. And again, as my nurse colleague has said, it is a calling in a sense. And if it's not, then, and you're going through the motions, certainly burnout will be there. You must work hard. You've got to work many hours. Medicine never stops. It's 24/7, whether you're working that shift or not. And for me, even in my earlier years, I work a full day, and I was delivering babies at the time. So babies come when they want to come.
Wow.
So 2, 3 in the morning, 4 in the morning, and I'm still, you do that, and then you get refreshed and you go back to work again for another day. So it's hard work. It's tedious work. Many times, and many of my physician friends will tell you that we missed out on a lot of the memories with our children growing up, and we missed out on the family gatherings and different things like that, just because of the calling that we had on our lives. So it's hard many times on families, and I'm not saying these to be discouraging. I'm saying it to encourage that person who really wants to get into it. Say, go in with your eyes wide open, because once you go in and you're there and you've made it, it's there's a lot of challenges. In addition, with me being in private practice, you got to fight to get paid. You got to fight the insurance company to get the money that they owe you. You've done the work, now pay me. But what profession is going to be out there? I mean, when you go to Walmart and it says this costs $20, you give them $20. When you come to my office and I say I want $150 for this visit, insurance company pays me $50. What other industry does that? Gives that much big of a discount to these big insurance companies, and the person who loses is the person who's paying out of pocket, because they have to pay that whole $150 because they haven't negotiated a rate. These are the type of challenges that we have. But again, not to discourage you, because the glamour is there, the fun is there, but you have to learn that balance. And it took me some years to do it, but I'm at that point now. I'm just gonna be honest with you.
Can you,
brought
Dr.
up a
Burton, I
good
know this
point,
is
though.
out of this. Do they have a price for the black doctors and a price for the Caucasian?
No, I don't think it goes that far.
Okay.
They are equal opportunity take away from you people.
Which is the reason why we have such a low number of providers per patient
Because of the way it's paid.
here in the state of Georgia. I think we're number 49, I want to say it,
Wow.
at the bottom, as far as especially mental health providers. Mental health providers.
That's a
We
whole
have the
nother-
lowest in infant mortality and maternal child health. We're
No, you mean highest?
kinda-
Highest.
It's
I mean, that's what I
highest,
mean.
yeah.
Highest. I'm sorry. Our numbers at the bottom.
Right, exactly.
So, and that's part of the reason that whole I asked for 150, I'm getting 50, or people just are not. They rather practice. When my dad was receiving care, his physician left to go back to New York because she had many more resources to provide for her patients. They don't recognize child, adolescent mental health like how they do, and so she went back to New York, and that was a loss for us.
So we have to continue as public servants, politicians, whatever title you'd like to give us, to continue to be advocates for the best care for our constituents and for all people. Councilman Davis and I sit in the seat as being a council members, which is on this level. However, we still can be very influential and speak to our colleagues on different levels in making things happen. Unfortunately, a lot of doctors have gotten out of the field because of what you discussed, Dr. Burton, as it relates to the billing, and you see that side
Of course.
a lot more harder than what we even see on the outside. So let's shift a little bit. Our last conversation, let's talk about natural medicine. We have a lot of individuals, including myself, who have been doing more research on the natural instead of taking the pills and the all the pharmacy and it works. It takes a little bit longer for some of the natural medication to get in your system, but on top of exercise and eating healthy and all of that, do you support natural medication as well as both, or which would you support more?
So, I have, I think, a healthy ideas about holistic and natural medicine. In medical school, obviously, that's not one of the things that's emphasized. And so, when you first come out, you're, medicine. Here's a pill, here's this, here's that. But as I've matured in my profession, I realize that for that type of medications. As a matter of fact, in some ways, I've educated myself on a lot of the things that we would consider natural. I certainly recommend them on some occasions, but mostly it depends on what the malady is and how dangerous the malady is. When you're talking about someone who is, and I'll give an example, totally out of control high blood pressure. Okay. I'm not going to be a naturalist on there because those types of things aren't proven to bring it down. Now, once I get your blood pressure down with, mainstream medication, now if you want to do supplements, I want to make sure, of course, the diet and the exercise, as you mentioned, all of those things are incorporated, and then we can talk about or think about decreasing some of the synthetic medications that you're talking about, the medications that I prescribe. Then we can talk about that, but they all have to work together. Some people say, well, because I do get those type of clients and patients that come in and say, I just want to do this all naturally. And I say, well, we can try that for a few months, but if you are unsuccessful, then please open your mind to taking regular medications, because if your blood pressure is 175 over 100 today, and you come back and say, well, I'm going to diet, I'm going to decrease the salt in my salt intake, I'm going to exercise, I'm going to do this, and you come back 3 months later and you haven't done any of those things, or even if you have, and your blood pressure is still 175 over 100, or maybe it's 160 over 95, so it came down a little bit. Then we need to get you on mainstream medication and get this down, because it's like a ticking time bomb.
Yes.
The longer you wait and the longer you allow this thing to go on, the worse off you're going to be in the future. I'm seeing 10 years, 20 years down the road. I'm trying to help you prevent that stroke. I'm trying to help you prevent that heart attack. I'm trying to help you have good health as mentally and physically for as long as you can. You know, people talk about longevity. You know, it'd be wonderful to be 100 years old, but I don't want to be 100 years old if I don't know you,
Right.
or if I've had a stroke and my quality of life is just terrible, very poor. I want to be 100 years old and know you, and getting around, doing a little walking, playing with my now great grandchildren, you know, if you will, that sort of thing. And it's how well are you into your later years?
That's a really good point. Something you just said that I've never heard it like this before. Is, okay, that's something that we can look at natural, but here's where you are now. Let's hit it aggressive and work on that later.
Exactly.
That's a very good point. That's a really, really, really good
Tends to
point.
be my
What do you
approach.
think, Councilman Davis?
Great.
Really good point. I could just go on and on and on. We have to do like another session, but I wanted. I know we said this is. Can I make one more comment?
Make one more comment, then we'll hear from the young ladies.
Okay. So, as an African American female, and listening to my grandparents, my grandmother on my dad's side, she passed away at 103. So she was born in like 1903. Something way back then, which tells me that her parents and her grandparents were slaves. So just listening to my aunt talk to me, and I was honored to be able to meet my grandparents. I didn't meet my great-grandparents. But to hear her say things like, as a African American people, and this is why I think people who don't look like me, and I can only tell my experience, may not understand the whole picture, that when some of our ancestors were brought over here from Africa, that was trauma already. So you're talking about trauma or genetics passing on genetically, like blood pressure, diabetes. I believe, and please tell me, doctor, nurses, if I'm incorrect, that trauma, environment, mental health, those things are passed on as well. So as an African American female, I feel like we were already way steps back in just how we began our life. There were some of our, and I think I talked about natural medication because my ancestors, they didn't live in like the houses. Some of them lived with masters, some of them didn't. So they had to use the herbs and things like that. Like my mother never dealt with hot flashes. I think I might be having one now. But because of what they ate and how, so I'm just saying that there has to be a time I hope, that we can come together, when I say we, people, and listen to your past, and I listen to your past, and I can listen to the past of other individuals that don't look like me, and we understand, or we try to understand, a median of where we can communicate about differences. And until we get to that point, because there has to be a point, I do believe there's disparities, and there always will be, but until we can talk about the differences, how can we move forward?
Well, we have now cultural, I think it's part of our mandatory training at most facilities. Wouldn't you say the
Cultural awareness.
Cultural, we have to do that every
Diversity
year.
training?
Yeah, the diversity training, cultural sensitivity, things like that. Because
Good.
there are, I had the fortunate blessing to travel around the world recruiting nurses at one point.
Wow.
And you go, I didn't understand when I was in India. I thought there was a deficiency in the water because everybody was doing something I wasn't familiar with. And then when I asked one of the gentlemen that was with us, is there a deficiency? What everybody's doing? You know, and it was explained to me, no, that's how we do this when we agree to something.
Oh.
Indian people do this.
Yeah.
When I was in the Philippines, this is, you can't, you know, and our mamas was like, come here. You better not do that. To certain cultures, it's very disrespectful. So that, and just like with us, when I was in, I was recruiting because I was in HR as a nurse recruiter, and because an applicant wouldn't give eye contact during an interview, they were disqualified. Oh, he didn't give me eye contact. We weren't taught to. We were taught staring in your face is disrespectful. We better not look. And so nowadays you can find out that, like, if you want to really, the person that's staring you dead in the face is more. I saw this on one of them TV shows. They're more apt to be the one that's lying to you than the person that's looking down when they're answering your questions. Because that one that's staring at you is like, let me see if you know I'm telling the truth or not. But these are just different things when you say, about what we're talking about, that cultural sensitivity is extremely important.
Awesome.
So when you travel all over the world, so did you know what you was getting into when you?
Oh, yeah. I mean, because, we were hustled in, and not hustled, but it was, we were versed on, who we were going to meet. We had like 7 minutes a piece per applicant, and there would be like thousands of people lined up at the different convention centers to be able to have the chance to work as a nurse in the United States, because we had at that point, this was before 911
shortage, and
a nursing shortage that is tripled now. And so, we traveled all over recruiting pharmacists, nurses, and teachers, but our job was nurses.
Right.
And,
Interesting. And Miss Shauna, the final remarks. Sheila has just taken us.
I'm sorry.
You're very passionate about it.
So she'll have it.
So you was a missionary doctor?
Oh, no, I mean, I've loved my nursing career, and that's what I'm saying. If you can do it and you have the heart, I've loved we have traveled to mission trips. We actually going to Africa in September with the House of Dawn. And here with Ollie's Place, my nonprofit, we've gone to Jamaica. We've been out there just everywhere, teaching CPR, doing
that's so wonderful.
Doing health, maternal health. I just love what I do. And
Can I ask one question? Then we're going to move on. Have you ever delivered a baby?
Just 3 wonderful sons of my own. And that's what I wanted to be. I wanted to be OBGYN until my first clinical, and I heard all these women screaming. I was like, no, thank you. No, thank you. I can't give them no drugs. So I just love adults. And,
Okay.
Yeah.
So, Shauna, what would be your last comments?
In reference to...
Just tying it up, what comments would you like for our audience to hear?
Just everyone to be passionate about what you do, going back to the conventional versus the holistic medicine, to combine it. If you're going to choose one or the other, I would say do a combination of both, because conventional medicine works, natural medicine works too, but as the doctor was saying, you got to make sure that you stabilize one. I've had patients at a hospital that, she had breast cancer, and she knew she had breast cancer, but she wanted to do the holistic, natural approach. And what was sad about it was, I'm walking, I just got report, but you can walk up the hall and you can just smell the infection. And it was because she had let it go with natural medicine. She had let it go so long, and now she was forced to come into the hospital. And it's kind of like when we see a Grady, it's like you're behind the 8 ball at this time, and you're playing catch up. So now we're trying to use conventional medicine, which could have been used at that first beginning stages. Exactly. So if you're going, I just say be an advocate and, educate yourself and, arm yourself with knowledge and talking to the right people that's going to give you the right information for taking care of yourself, because, both medicines or both modalities do work, but some work, in a combination versus others.
Good.
All right. Well, thank you so much to our
We got to ask
Listening
one more
audience,
thing.
I'm sorry.
Just in case Dr. Burton got the last.
Okay,
Dr. Burton,
Dr.
you had a
Burton.
last of the
I'm
last.
sorry.
Growing up in
Burton.
Temple, Georgia, and your mother, I got to say about your mother was an athlete. Y'all
Yes.
read up about his mother.
Oh, really?
Fighter.
Oh, my goodness.
What's
Just
her
from
name?
what he says about her.
Dorothy
is-
Burton Calloway.
Yes.
Yeah, you know, that
Thank you.
I was
Councilman.
blessed as far as my mother was concerned. She unfortunately passed away today, a month ago. And but she lived to be 84 years old. But to have been her son and to have been in her presence, because she was precious. She was a trailblazer in
That's
history
right.
herself.
Yes.
That's right.
The first African American woman to be on the school board of Carroll County, and then also the first African American woman to go on to lead that school board and be the head of that school board. She had 40 years of education, and she made sure that her son and her daughter, my sister, who was also a doctor in her own rights, cross the T's and dot the I's,
That's
and make sure you do it right the first time. Make sure that you understand that as an African American male or female, that you're in a position to be a trailblazer or not, and which one are you going to choose? And she drilled that into us. So I'm proud to have been her son. She was a great woman. She was a great woman.
That's what I want to hear. And thank our listening audience and we have a live audience out there today. Do you all have any questions before we sign off? I guess not.
Yes, I
Okay.
have a question. When we was talking in reference about getting the information out to the people, to the public, I think the black ministers has failed us because most of the black churches didn't have too much to do with the COVID. Maybe one or two was invited around to come, but more black people go to church than they go anywhere. And I think that the black preachers, whosoever the entities are that gets this stuff, I think the politician, whosoever, should have went around and talked to some of the black pastors and got it in, the information out to people. Minister plays an important role in black people. And when it don't come from the church and that pastor, you don't want to hear it. That's my take on it.
Okay.
So,
All right.
Churches were closed, most of them.
Right.
The brick and mortar
They have
building.
but they did
But they
virtual.
did do virtual, and I agree that there is a huge opportunity there to pastor and to pass on that education, and it does it does make
Makes
a
a
difference. That's what we're doing with the mental health,
Right.
trying to get it out. You can Jesus is real, but it's okay to have therapy too.
So, it's really, thank you for the question, Mr. Hooks. And, although we're sitting here on the panel discussing what we need to do as an African American people, we can be very real with ourselves. And with Mr. Hooks making a comment of a lot of our African American pastors behind the pulpit, unfortunately, failed to make announcements. Of course, there was many churches, the doors were closed, so they didn't open, couldn't open, could have, but they chose not to. So I agree, not just with COVID, but yes, African American, especially in this community, we do have a lot of African Americans that do go to church. So yes, and gong ho to those pastors who made it their priority to encourage, and also to those pastors who allowed their parishioners, members, to make their own decision. So I agree both ways. But whatever we can do to get information out, whether it be over the pulpit or someone you're talking to, but we have to also police ourselves as African American. Everything is not race. Sometimes
Okay.
it's us.
Thank you all for coming, and I think this is it for the segment.
So we pause for this interview section, and we'll be back with you momentarily for the second half.
Thank you again, our listeners. We're back, and Council Lady, we're back for our second segment.
Yes, thank you, Councilman Davis. I am Councilwoman Dr. LaShawn Danley, and you heard earlier in our first session, Councilman Davis and I share the ward in Ward 3, which is the New Horizon, and I am Councilwoman Dr. LaShawn Danley, Post 2. Councilman Davis is Post 1, but we do serve in the same area. So we have a special guest here, and
Oh, my
Councilman Davis,
goodness.
who do we have with us?
I don't want to mispronounce his name, and you're
Dr. MJ Collier,
All right.
host, producer, on-air personality of the Your Health is Important radio broadcast and primary care physician, serving the community of Douglasville for over 30 years.
No way, Dr. Collier.
yes, Doctor. How you have? I probably. How many years was Parkway Regional out there, Doctor?
Parkway Regional recruited me to come to this area, and I moved and started practicing in 1989.
And that's where I met Dr. Collier right there at Parkway Regional.
Oh, Dr. Collier, you go way back.
Way back.
So tell us a little bit about your practice. How did you get into medicine?
Well, most people that go into medicine have had that as a career choice throughout. I remember as young as the third grade, I was totally and completely fixed on what my objectives were. People say, what do you want to be? Never hesitated saying I wanted to be a doctor, which actually I don't recommend at this point when I'm talking to young people and I'm doing career day speeches. I tell them, I say, when you have the curse of high achievement, you have choices and options. You need to look at all of your choices and options and have an A, B, and a C plan to see how life goes with you. But I was focused. I just always knew that I wanted to be a physician. I had some friends of the family. Nobody in my personal family were physicians, but some of the friends and doctors that were taking care of me in the neighborhood were great role models and mentors, and just when they became aware that I was interested, started to nurture that in me.
Wonderful, wonderful. So, Dr. Collier, Continuing Moments is a time for the city of Douglasville to focus on African American history, Black history, specifically in the city of Douglasville. So, one question that we ask the doctors prior to you being on this session is, what challenges have you faced being a physician as an African American male?
One, just that, being a physician as an African-American male. I remember earlier parts of my practice, particularly when I first came out to Douglasville, it was predominantly majority of patients. And the vast majority of them accepted me without question, without problem. But even today, I'll have patients that will come to my office. They call me Mr. Collier.
Mr. Collier?
Versus Dr. Collier. So they're genteel enough to refer to me as Mr., but knowing that I'm Dr. Collier, and I'll correct that immediately. And really way back into practice, and this just hopefully doesn't go on in this day and age anymore. I remember a patient that came to my office with his girlfriend or wife, I'm not sure which one it was, and she was coming in for a GYN exam. And so when I came out and I came to the front desk to talk to the nurse about something, he saw that I was a physician of African American persuasion. He literally came back to the back of the office and got her out of the room and took her. And so those incidents few and far between, but they do happen and they are a reality. As an African American professional, you are challenged even by African Americans that are educated.
Yes.
And we've all heard stories of people saying, that if I'm going to get a lawyer, I want to get a lawyer that's of a certain persuasion. If I want to get, and I'm not going to a doctor that's this way and that way. Fortunately, now we are much more educated, and we realize that culturally sensitive healthcare in particular is very important, and that it's been documented in multiple studies that you have better outcomes when you're being treated by someone who looks like you, knows and understands your culture, knows what you eat, knows what you like to do, knows what you like to drink. All those sorts of things are very important when doing so. I know that I've had patients that have had diseases that your grandmother could diagnose. All of us familiar with a fungal skin infection,
Yes.
grandmama called tetanus, and they go to a dermatologist who's never seen it. He does the $1 million workup and the biopsies and tells you it may be cancer and scares the heck out of the patients and all of that. Whereas grandma would look at this and say, oh, just put some Blue Star ointment, put a little salve on it, and that'll take care of it, because that was a cultural experience. So it's very important, again, that people that know you, know your experiences, live what you live, and are in your community, that you support them and they support you. So I
Correct.
think that over the many years of my practice, I have observed that phenomena in the Douglasville area. I have multiple physician partners that are in this area: Dr. Michael Moody, Dr. Valencia Burris, Dr. John Johnson, Dr. Kelvin Burton. All of us support each other's practices and provide call coverage if I'm going out of town or going to be out of the office or something. I know that my patients are well taken care of because Dr. Burton is going to answer the calls for me. So that having that network helps tremendously as well.
That's awesome. So, Dr. Collier, what is your specialty?
My specialty is primary care. Yes, so I see men, women, and children. I used to go down to age 2, but now I let the pediatricians do that. And so I start seeing when children start to be uncomfortable going to the pediatrician, that's when they can come to see me. So that's usually in the, around 12 or so.
Right.
Definitely by the time they're in their teens.
Yes.
And then adults, the parents, and now since I've been practicing long enough, I usually have multiple generations. So I have the grandparents, the parents, the children,
I
at least
love
3
that.
generations in one family. That helps tremendously too, because I know if grandmother has high cholesterol and
Yes.
diabetes, that I need to look at the grandchildren to make sure that they don't get it, or if they do, that we control it, we diagnose it early and start treating it and start to do some interventions that might impact them developing that disease state, because we know the entire family.
Right.
So taking care of husbands and wives helps tremendously as well. We know that women are the patriarchs of medicine in the family, and they're the ones that get the men to come to the doctor. So when I have a wife that says, my husband, has this problem, I really want you to see him, I say, well, bring him in, and we'll take care of him. And, that works wonderfully as far as capturing the entire family health.
That is awesome, and I like the approach that you have, that you treat the entire family, so you have some continuity to see them grow. This is really passionate for me, but I don't want to take all the time.
Oh
Councilman
no,
Davis, you have a
let's take all your
question?
time, because I know Dr. Collier has on a personal level, and during the time that we had the shot for shots out in the street at a local lab, my friend called me and said, I got some celebrities to be coming out and treat them well. And I was amazed at the celebrities that you sent out to get a shot for a shot at
That's
a local,
awesome. Thank
at
you,
a
Dr.
local
Collier.
lounge,
Wonderful.
local bar.
That was such a dynamic and phenomenal program, because people were looking for, we're talking about the early days of the coronavirus, COVID pandemic. And when the shots first became available, people just didn't know where to get them, how to get them. They would have to call 800 numbers that were never answered and get appointments that never
Exactly.
happened. And so we were bringing it to the people, and you and I were just having a casual conversation. And when you told me about it, I was like, wow, that's great. I said, I have some I take care of a lot of what I call celebrity patients, and because I'm in the entertainment industry as well, so that allows me to meet a lot of people.
Yes.
So they want private and sometimes special treatment, but more importantly, the vast majority of the time they enjoy meeting people. They just want to meet them in a controlled environment.
Yes.
And so, but nobody wants their healthcare issues. They don't want to have somebody taking a picture of them and it shows up on social media,
Exactly.
and they put any story that they like with
Sure.
it. We saw, so and so going to the doctor's office. We don't know what was wrong with him, but he looked sick.
Right, right.
Those sorts of things. So it is, very important. Anybody that comes to me, their anonymity is maintained and preserved in all of their privacy. So my staff knows that you can't take pictures and selfies with the celebrities. You can't post, guess who came to our office today, and all
Right.
those sorts of things.
Right.
So they clearly understand now, and they themselves have become friends with a lot of them, because they know that they can trust them and they feel comfortable coming to my office.
So, Dr. Collier, earlier we were talking about, in Georgia specifically, that unfortunately Medicaid is not expanded.
Mm-hmm.
So there's going to be about 600,000 individuals without health care. My question to you is, I heard you say one thing earlier, is I wouldn't recommend anyone to go into this practice right now. Being passionate, but are you saying that because of like pharmaceutical insurance billing? What is the challenge? And we're not just talking about you're just being an African American, but just being a doctor in general.
Just being a physician in general. Well, the practice
This
of
day and
medicine
time.
has now become a business, and it is not, for taking care of sick people. It is for generating profit based on insurance capabilities. And so people that have I don't even like to use the term good insurance because there's no such entity.
Right, I agree
right.
with
It's
you.
bad insurance and really bad insurance. But there are literally computer programs that will analyze a person's insurance in real time. And they say, okay, the insurance will pay for this test, this test, this test. And so the person gets that test whether it's clinically indicated or not. And so I tell people, you go to the emergency room with an ingrown toenail, you're going to get a CT scan and an MRI. It's going to cost you $40,000. That just makes no clinical sense. And that's why, it's so much waste in the medical community as far as cost is concerned. It should not cost $900 to $1,000 for a diabetes medication on a monthly basis. No one can afford that. And it probably costs them $1 to make it. Who knows? But my point being that, profits are, again, it's the business of medicine, and it has negatively impacted most people, particularly providers and patients. So lots of money in healthcare, but not for the providers. The people that are actually doing the care, they're not generating this income. And I have to share that with people all the time. They say, you rich doctors. No, there are no rich doctors. I don't care what your specialty is. Even, friends that are cardiologists and surgeons, they have had to cut back tremendously on their lifestyles because they're just not getting paid what they have gotten paid previously. And there's no other profession that does that. My plumber comes to my house and the toilet is plugged. He tells me what it's going to cost, and I have to pay it.
Right.
And that's it. There's no discussion. There's no what's your deductible. There's no this is how much it's going to cost. So, the reality of the matter is that regardless of what my fee structure is, I only will get paid what the insurance companies say that service is worth.
And that has nothing to do with the color of your skin.
Nothing to do with the color
That
of your skin.
is, however, for individuals who do not have insurance or do not have access to health care, unfortunately, it falls a lot on low income. And low income is at risk, whether you're African American or whatever color you are, Caucasian, Latino, it doesn't matter. It's horrible.
Yeah, it's not even necessarily low income now. People are making a conscientious decision. I had a patient that came in last week, and she's, I would say, middle class, and on her chart it said patient pays entire bill. And I said, patient pays entire bill. I say, what's going on with your insurance? And sometimes beginning of the year, there's you change insurance, and they say, oh, well, I said, just get me the information and we'll take care of it. But no, she said, my insurance had gone up to $900 per month, and I just can't afford it. And so she dropped the insurance, and so it's actually less expensive for her to come and pay for that. Now, of course, there's a problem if you need to be hospitalized.
And it's limited to what?
It's limited, but but just for your routine primary care, it's much cheaper to just go to the doctor, even on a scheduled basis. Like my diabetic, hypertensive patients, I see every 3 months. And so you could definitely do that for much cheaper than the cost of actual insurance in doing so. So safety net organizations like community, federally qualified community health centers, FQHCs, the most prominent here would be Southside Medical Center, provides great care. Same doctors that you see, my dentist works there and has a private practice, and I see the same dentist that everybody else sees. So that type of safety net helps, but it is not comprehensive. Expanding Medicaid would be ideal to capture that, but they really need to make some adjustments in what they're covering with Medicaid. When the Affordable Care Act was first introduced, it was a very good concept and a good healthcare system. But to get it passed, so many compromises had to be made that, it's, again, it is insurance coverage, but people that are on it now, they can't go to that. Doctors don't take it.
Right.
If I see a patient and I accept it, but when I see a patient that accepts it and they need to be seen by a neurologist or an orthopedist, can't find coverage.
Yes.
And so even though to be an insured entity in an insurance service industry, you have to have total specialty coverage, supposedly. But, and they will put doctors on the role of providers that they never talk to, that never see them, and they're not participating physicians. And so just so they could get approval to do it. But when it's actually time to, to treat these patients, they don't have full network coverage. And so things like neurologists, it's just almost impossible. So, but in that pecking order, orthopedics is very difficult to see with those types of compromised insurance products. So, in the good old days, back in the Parkway days, etc., if you were a physician on call and a patient came to the hospital and you were on call, you saw that patient. If they had insurance, fine. If they didn't have insurance, you saw that patient and took care of them through that disease process. I had a patient that came to my office with a broken arm. And I said, well, why are you here? What brings you to the office today? Well, my arm is broken. Were you seen in the emergency room? Yes. Well, what did they do for you? Well, they say they didn't do anything. I said, well, no. I said, if your arm was broken, they would have done something.
Right.
And I'm just saying this could not have happened. And they had a pillow over the arm. They removed the pillow. The arm is literally at a 90-degree angle. It is fractured. And they didn't do anything about it. And it said, in the acute fracture phase that, you don't say that you don't do anything. And then, follow up, they gave them a referral to the orthopedist. When they go to the orthopedist say, we don't take that insurance. So then they just come to my office, And so now.
And what do you do?
Exactly.
Starting over,
trying to treat, and again, that has just been mismanaged, and in a variety of different ways. Especially care. When a patient came in, they were having a heart attack or a stroke, and you needed to see them. You came to take care of them. It's what you did. Now, they say, their first question, what type of insurance they have. They don't have the right insurance, or the insurance they take. They don't take them. They don't accept them. And so I have observed this total lack of compassion in healthcare, and again, and healthcare going from a service industry to a business. And sometimes it's not in particularly the doctors that work for someone. They don't have the opportunity to make a decision. Well, I'm going to see this patient anyway, in doing so. But fortunately, being in private practice, I can see patients and do all the time, and that may not have the ability to pay me, but I say, okay, well, come, I need some woodwork done, or I need something. We can barter services, or I'll just take care of it, no problem. And and we do that. We do so many things in the community. We have annual, quarterly health fairs that we partnered with the local radio stations here and changed health fairs as you know it.
Yes.
So most people's health fairs, it's in the basement of the church, you see 30 people, you had a good health fair.
Right.
We started doing live remote broadcasts with the radio stations, and we went from seeing 30 people to thousands of people. Thousands of people, impacting them in a way that they, introducing them to the healthcare system, partnering with places like Southside Community Health Center and the physician members of the Atlanta Medical Association. We quickly learned that screening somebody at a health fair and just checking their blood sugar and say, oh, you have high blood sugar, you need to see somebody, or you have high blood pressure, you need to see somebody. That was a disservice because they didn't have anybody to see. So then we put a network into place that if we saw you at the health fair and you needed follow-up care, you would leave that entity with an appointment to see somebody immediately, or sometimes we would even send you over to, particularly if the health fair was on Saturday, Southside is open on Saturday, we send you directly over there.
Perfect.
And they'd be ready, willing, and able to accept you. And Southside sees patients on a sliding scale basis, which means your actual cost may be zero, depending upon your financial circumstances. But I do have to say something, too, about patients. Patients need to understand you have to be willing to invest in your health care. It's not totally free. Sometimes you have to spend $1.
Right.
Don't tell me that you don't have money to go to the doctor, but you got the latest iPhone, you got designer, everything else, you got your hair and your nails done and everything. When seeing the doctor would have been $40-50.
Yes.
And you spend $150 on other things.
Right.
So you have to sometimes reorientate your priorities and say, that I'm willing to invest in myself. And this is a conversation I have on a daily basis almost with patients. Telling them, I say, sometimes you have to be willing to do that. It may cost you something. I say, did you get that prescription I wrote for you? No, it was too expensive. Well, what is too expensive? It was $30 a month. I say, that's a $900 drug.
Right.
And you got it for $30.
Wow.
So you partner with good community partners. Here in Douglasville, there's a pharmacy, Premier Pharmacy. Absolutely amazing community
Phenomenal.
partners. Great prices on their drugs. Never turn anybody away. And, they're, in addition to providing all of your immunizations for the pandemic and your flu shots and everything else, drugs that might cost you, again, $100 at one pharmacy will cost you $10 or $15 there.
Right.
And you know, it is absolutely incredible that their willingness to serve the community, and of course they got to stay in business,
Sure.
but you don't have to, you know, send all your children to college on one deal, as I like to say.
Right.
You know, so it's you can be in business and still serve, and that's
Right.
kind of the attitude that you have to take in healthcare. So you got to have a provider that's willing to see you, but ancillary services. Sometimes people do need surgeries, and so I have to have friends that have surgical centers that can make compromises and say, look, you know, you don't have to go to the hospital. You come to my office and we can do that surgery, because most surgery is outpatient today anyway.
Right.
And these are certified surgical centers, the same things that you get in the hospital, but at a much less
I'll
cost.
tell you what, Councilman Davis, you've been honing back on Dr. Collier. So, Dr. Collier, where have you been? And where are you
yeah.
located? And how can people find you? You're talking about radio? Tell our audience.
Okay, I'm the medical consultant for Reach Radio 1, and I'm heard
Radio 1.
syndicated on the Ricky Smiley Morning Show.
Okay.
On Wednesday mornings, I do a segment called Wellness Wednesday. It airs at 8:20 Eastern Standard Time. And I'm also, whenever there's a medical issue, you know, they may call me and ask me, you know, to give a comment about it or talk about it and make it so that people can understand what's going on. We've had two of those recently. The death of Elvis Presley's daughter,
Yes.
Lisa Marie Presley, and then the football player that had the heart attack and basically died on the football field.
Yes.
That happened on Sunday night, so they called me Monday morning. We need you to talk about that this morning. So I'm, you know, they're ready reference from that perspective. I have been doing local radio for 30 plus years on several radio stations, B103 here in Atlanta, on the FM dial, on the AM dial. I'm the medical consultant for Too Much Truth with Derek Bozeman on WOK. And I grew up on WOK when there was only AM
yes.
radio here. And so all of those things have, you know, given me an opportunity to meet people in the community. But with the nationally syndicated radio broadcast, I literally can serve hundreds of thousands of people.
Wow. So your practice is in the city of Douglasville?
My practice is at I-20 and Thornton Road.
Okay.
Yeah, so
Still close to Parkway?
Oh, yeah, I literally
Right
was in
there,
the
right
parking
there
lot
in
of
the
Parkway.
parking
I was
lot.
literally in the parking lot of Parkway before they towed Parkway down, which
Wow.
made absolutely no sense, but they did. And so that the administrator at Parkway recruited me to come to this area, and it was a very, very nice. It was a male and a female. Unfortunately, I can't think of their names right now. But they invited me to come and to practice on that campus, and I did. And I set up. I was working at the time at a medical facility called Pri-Med, that was in Mapleton, or MedFirst, MedFirst in Mapleton. And it started off as Pri-Med, but changed it to MedFirst, and which was a series of urgent care centers that did primary care. And so they came, met me, or was introduced to me in some form or fashion and said, we really need you in that community. Can you come out and do that? And so after much discussion and thought, said, yes, that would be great. Now, I live in Douglasville in Grace Lake, so I'm very close in this community. Again, take care of, you know, a lot of my neighbors as well as a lot of individuals throughout Douglasville, most of whom you know. So it's been an honor and privilege to serve this community, and I will continue to do so.
And he used to practice with Joe Fowler's brother, Ray.
Wow.
Yes.
Ray.
I want to
He
tell
he
you.
in Texas, right?
Dr.
Yeah,
Collier, this is just so amazing. In fact, my oldest daughter, I gave birth at Parkway and met my OBGYN, Dr. Linda Ford, who's retired now.
Who was a very
Did you
good
know
friend of
Dr.
mine.
Ford?
Yes,
Yes.
I love
I used
Dr.
to go
Ford.
wash her car.
She's retired now.
She's retired now, and she called me to let me know she's retiring. And a lot of the patients because I do primary care, a lot of patients she sent to me, and she's so welcoming, so
Yes,
nice,
yes.
a very elegant lady,
Yes.
and a true professional, and welcomed me to this community when I was just a little young whippersnapper, and you know, and she said, look, this is what you need to do, and these are people you need to know, and really just welcomed me and accepted my referral patients and sent patients to me, and just helped. You know, she was a good friend in this area, as were most of the doctors. You know, I quickly was placed on as chairman of various committees at Parkway Hospital, and had the support of the vast majority of the staff. I can't think of a single person that I didn't have a great relationship with. So it was a welcoming community. The community that was practicing there was relatively diverse, and so that helps tremendously.
That is awesome. Do you have any questions, Councilman?
Uh,
Since you know him personally,
we go way
give me
back.
some time.
Dr. Ford had an automobile like Dr. Collier back in the days, and I would go over the house and wash it and clean it up for her. And I wonder, does she still live up that long driveway?
We're not gonna say what Dr. Ford lives,
that
but
I'm not sure.
But yeah, Mr. Fowler and question I got
Dr.
to ask.
Fowler,
Ray.
Dr. Ray Fowler.
What I question I ask, you had a lot of people talking about where they can get surgery overseas cheaper than they can here. Is that a true form? But they say they can go somewhere and get surgery.
Oh, you can, and 20 years ago I would not have recommended that, but nowadays, there are the same physicians that are practicing here are going to the Dominican Republic, Punta Cana, Mexico, and physicians that were trained here in the United States are practicing in those areas. I have a friend right now that is very, very well off. He's I would use the term rich, but he goes to Mexico and gets his dental work. And because it's 20 cents on the dollar, for the things that he can get there. He can get a full set of dental implants there for, $3,000-$4,000, and here is $40,000. So that the economic reality is that you can get quality health care out of the country, and people are doing it, particularly surgical procedures. Now, I'm not necessarily recommending that from the perspective of people go get these surgeries, fly back to Atlanta. They don't have any post-operative care. They show up in my office with festering wounds. They didn't tell me what to do. They didn't give me antibiotics. And so this is a dilemma somewhat, because, you don't necessarily like cleaning up somebody else's problem, but you cannot ignore the patient as well. And people have chosen to do that. So I tried to be proactive and say, look, if you're going to do that, let me do your pre-op physical. Tell me when you're going so I can expect to see you. Schedule a follow-up appointment with me immediately upon your return, so I can be actively involved in the process.
Oh, that is so cool.
And so that, that's just the reality of the matter now, that you have to do that. But a lot of people are going for cosmetic surgery now. The tummy tucks and the mommy makeovers, those are really big. Doctors, again, that do it. They're doing it. They go to Miami, and sometimes they do it in Miami. Other times they do it, offshore. They catch a boat and go somewhere and then come right back. It's a system in place to capture that business.
Black men with prostate cancer. And speak a little bit about the Afro-American prostate.
Prostate cancer disproportionately affecting men of color. And again, that's one of my passions. I'm involved with an organization called CHAMPS, Community Health and Men's Promotional Summit. We started screening men for prostate cancers along with Dr. James Bennett, very prominent urologist here. Not just he practices in Atlanta, but he's known around the world.
I know Dr. James Bennett. He over there, is that Piedmont?
Now he's at Piedmont, correct. Has his own surgical center.
Yeah.
So you could go to his office and get a lot of things done. I send he's my first choice for every patient that has a urological problem. And when I hear people say, "Oh, I don't want to go all the way that far," I say, "Look, we're not talking about going to buy some clothes or a hamburger. We're talking about a surgery. You want to go to the best person available. You want to go to the person that's the most convenient." And so when rethinking it from that perspective, people say, "Well, I say, who you think I'm going to if I have that issue?" And so we have worked together again. When we started the CHAMPS community health screenings for prostate cancer, I told Dr. Bennett, I said, "Dr. Bennett, you're not going to get men to come out for prostate cancer screenings alone. You got to offer them something else." And I say, because the vast majority of them are going to have high blood pressure, diabetes. You got to check for those things too. So we kind of incorporated my traditional healthcare scenario with the prostate screenings. And the first time we did it, we had literally a line of men that was 2 blocks long in downtown Atlanta. His office was at North Avenue at the time, North Avenue in Piedmont. Line was 2 blocks long. We were not prepared for that type of crowd. Literally had to go to the local pharmacy and buy glucose testing strips and other supplies, everything from Band-Aids to cotton balls from drawing the blood. Oh, yeah. So that changed everything. And you would ask the men, "Why are you here?" And they said, "Well, I heard it on the radio. I was going to the car shop and I heard it on the radio, so I stopped and turned around and came to the health fair." The power of radio is so amazing in influencing people, because when they hear you on the radio and they hear you talking about it, it becomes now an event. It's something they want to be a part of. And so the radio stations would help by, giving some giveaways, some tickets to concerts, and, have celebrities, guests there and that kind of stuff. But the bottom line is that once the men became used to coming to these environments and getting screened, they were no longer afraid of a digital rectal exam and being examined for prostate cancer. So I can state unequivocally that we have impacted the health of not just the men of Atlanta, but a lot from around the South. And the information, when people hear about it, because on the website you find out a lot about prostate cancer as well. But again, African American men, if you are over age 40, you should be screened. That includes a digital rectal exam. Nowadays, the Urological Association says you don't have to get a digital rectal exam. That makes absolutely no clinical sense. But there are several guidelines that have changed. Under the Affordable Care Act, Obamacare, if you will, there were 13 different diagnostic tests that were mandated by that insurance plan that people should be able to get for free, including mammograms for women, pap smears for women, prostate exams for men. So once mandated, all of a sudden, the guidelines say, oh, you don't need to get a mammogram every year. You can get one every 5 years, and after a certain age, you don't need to get any more. Men don't need to get digital rectal exams as often. They can get one every 5 years. And you know what happened since they changed those guidelines? The incidence has gone up in every category of cancer where there was a screening that has been changed. So and now you're not making early diagnosis, and early diagnosis is very important for appropriate treatment and good outcomes. So if you're diagnosing late now, you're hearing people when you could have got them in early stage 1,
Right.
now they're stage 3, stage 4. And so you got a major problem with that. So none of those changes in the guidelines are appropriate for African Americans. They really aren't appropriate for anyone. And so they actually came out and made that comment and that adjustment to the recommendations, saying these recommendations that you don't need to get a digital rectal exam or mammogram are for the majority of patients, but not for African Americans. African Americans should still be screened at this rate and that rate. And so, that just again is, but people don't hear about that.
Right.
They're glad to accept. Oh, you don't need to do that anymore. But but they don't say the guidelines that say you need to. You still need to get it if you're African American because you're at higher risk.
So, Dr. Collier, let's pause right there. And Councilman Davis brought up prostate cancer. So, with prostate cancer in African American men, why is it that the numbers are higher? Is it education, non-educated, being educated, or fear, access, insurance, all the above? What would you say would be that top?
It's all of the above, but one of the things that we are learning now is not because there was an immediate, sidestep to say, oh, they're just genetically predisposed. We're genetically predisposed to high blood pressure, genetically predisposed to diabetes. That's why we have higher numbers. Genetically predisposed to prostate cancer. So finally somebody said, why are black people always genetically predisposed? Why do we get the highest numbers? And so they started looking at it from a different perspective. That perspective being the social determinants of health. Your community that you live in, the foods that are available. Are you able to get good, healthy, fresh foods? Or are you in a food desert where you're only eating, at the service station, chiquitas or whatever they call them, and hot dogs that have been rolling for 3 days. Those sorts of things. That is very, very important. Access to health care. Are there actually, if you got sick, are there providers that you can get to and access? And a lot of communities there are not. So individuals, when you have to travel or you don't have transportation or you need to see a urologist and there is not a urologist in your area, then what do? You wait until your disease state progresses and then you have to, you'll find one in the emergency room or at the hospital.
You hit it right on. And just speaking of Councilman Davis, our ward, we have come a long way. Our ward is on the north side of Douglasville, which is on the other side of the tracks, and then some pockets on this side. But when you speak about fresh fruit, there is not one area, not one grocery store, not one bank, not even one restaurant. Yeah. So I want our listening audience to hear my voice loudly. It is imperative that you help us to advocate more for economic development throughout the city of Douglasville, specifically in those areas. And it's not just on the north side, but those areas where our families, our children do not have access to go to the store and buy a fresh banana or fresh apple. We need that. Thank you, Dr. Collier. That point right there says so much volume, because it's not because individuals may not have health care now, but where they live from years back or just now. That is great.
That is absolutely
Wow, I could
incredible.
listen to you all day.
And
You're amazing,
Council
Dr.
Lady, I
Collier.
tell you, we got to do some closing remarks. From
Oh, no, I'm not
Dr.
ready for
Collier.
closing remarks yet. But anyway, okay. I'm not ready for closing remarks.
Well, I want to say once again, thank you so much for having me here today, and don't hesitate to call me back. I love sharing information with the people. Two, I have been happy to be living in the community of Douglasville. I'm a native Atlantan, born and raised in Southwest Atlanta, and upon completing my training and moving to the hospital there, I moved to Douglasville. And before they built the mall and all the other shopping centers, and the traffic became as bad as it is, but it's amazing that this is probably the only city that I know of where the South Side has a lot of development and the North Side doesn't.
Yeah.
It's usually the other way around.
Other way
And
around.
so, but as you come, what has happened to the south end of Douglasville and even downtown, absolutely incredible. The city development, the city planners have done such a great job in designing the buildings, the density of housing. Now, on the south side, I'm getting a little concerned. We're starting to build some high density housing that I'm not sure the city can accommodate. And I'm saying, okay, how did they get past city council? But again, just something that I'm observing. But the downtown development though is cannot be compared to any other place. One of the places, the cities that I did like, Decatur, downtown Decatur, and
Right.
this far exceeds that. What I'm looking forward to is having some mixed use areas where you got businesses, places to live, and restaurants and things that could support
sir.
people
Well,
locally.
Dr. Collier,
Mhm.
real soon.
Mhm.
I don't know if you've heard about Town Green.
I have.
It's going to open this year. So, and there will be living space on the
Livable.
top, retail on the bottom, green space, and our amphitheater right here downtown.
So
Here.
Councilman Davis shared some of that information with me, but I'm so glad to see that was dreamed and now come to fruition.
Yes.
Because that is where we are now in the rapidly growing and developing cities that are prominent. They have mixed-use communities, and people want the green space. They don't just want to have buildings and buildings. They do want some space so they
That
can
is right.
socialize, and even the area down here between the buildings where they have concerts, and
Yes.
I've come down on a
You
Friday
know
night.
it.
They have bingo, and it's just amazing.
Wednesday wind down.
Where's the wine down? I'm going to call you up next time and say hello to everybody.
Oh, we're happy to do that.
Yeah.
But I just like to say some of our local entrepreneurs, I know that the owner of Grits and the Reverend Room and all of that, that's the type of development that we need down here. A place to go, and people. We definitely try to support. I bring medical conferences to those restaurants,
Yes.
and and I get my haircut locally, and all those services that you didn't have locally before.
Right.
Now you do. So you support and you dance with the one that brung you. You support the city that you're living in. I tell the people, I support the people that support me. When I say if I have a service that I need and you can provide it, I'm going to try to get you to do it. I'm not going to go through the yellow pages and
Yes.
just blankly call people
That's
when I
right.
know you do that service.
Right.
And so, that's just each one teach one is and being good community servants and neighbors, and that's what we want to be here in Douglasville.
Right.
And so, it's a growing, thriving city. I'm so glad when I look at the changes in the city government from when I first moved here, from the sheriff's office to the city council to the mayor to the chairman of the city council. All of these various offices are Spelman graduates and people that doctor in front of
Yes,
their
sir.
name. So well educated, well prepared, and well able to serve. And so this is again, that shows me the potential for Douglasville and where it can go. If we all stick together, have a vision, and then make that vision come true.
That is correct.
Thank you.
Well, Dr. Collier, this has been amazing. Thank you so much for your time. I know you're really busy. The wealth of information that you have shared with our listeners today will not be your last. We will invite you again, and we're going to have to take a rain check and get, again, like off script so we can talk. But this has been great. I could go on and on. And thank you so much for your time, Dr. Collier. To our listening audience, thank you so much for being a part. Share this. You can share the link with your friends, and you can watch this over and over, Continuing Moments with the City of Douglasville Black History.
And again, Dr. Collier, thank you. And can you get a listening audience and viewing audience the address to where Your location, your practice?
My practice is located at I-20 and Thornton Road, 939 Thornton Road, immediately adjacent to the Home Depot. One exit west of Six Flags, exit number 44. You can come there. You can also reach me on all social media at ASK Dr. MJ, YouTube, Instagram, Facebook. I do Facebook Live on Wednesdays at 6:30 p.m. Tune in and ask Dr. MJ, and you'll get the answers to your healthcare questions.
Good.
Wow, that's tonight at
That's tonight.
6:30.
Exactly.
Councilman Davis, we need to hurry up so we can be on
We
that.
got to call Uber.
Yes,
If you
okay.
get him there.
Thank you,
Oh my
Dr.
God.
Collier. Thank you, listeners.
Thank you.
Goodbye.
Thank you.
All right.
Thank you, Dr. Collier. Thank you. Well, welcome back, our viewers and our listening viewers. And I want to say this afternoon on our third segment, Councilman LaShawn. And let everybody know who you are,
All
Councilman.
right. So I am Councilwoman Dr. LaShawn Burr-Danley, and Councilman Davis and I serve in the same ward, which is New Horizons, Ward 3. And this is our last segment of this session for continuing moments of Black history in the city of Douglasville. And Councilman Davis, who do we have with us right
It
now?
has been phenomenal.
It's been awesome, hasn't
Our
it?
guest for this, our last segment, our guest, we saved the best for last. And we have,
Introduce
Kelvin
yourself, gentlemen.
Harris.
Okay.
and
Oliver Hooks.
we say the best for last, and I tell you, and the organization that they have here in our great city, and it's located on, you have the address?
8304 Holly Street.
And what is the name of the organization?
We call it JAWS, J-A-R, but it stands for Just Advocate Restorative Services.
Okay.
I love that.
So, we have been in this segment focusing on health. So, prior to our gentlemen that are with us right now with JARS, we've had our medical doctors, MDs, our nurses. Now, we're going to talk a little bit, dig a little bit deeper and talk about what do you see with the mental health and the individuals that you see on a day-to-day basis. So, tell us a little bit about who do you serve?
We serve people, we are 501c3. We serve people that's unable to pay, unable to be represented in the court, and unable to speak for themselves. The people we serve are people that had misdemeanors, felonies, assault, rape, and robbery. And we was talking about
As a charge, correct?
those are the charges.
Some of them. Okay.
Some of them. We have been very successful there for 4 years. We also do pardon. And a lot of mental health come from people just need a little help getting a job, getting back on their feet. Well, when you're 17 years old and have a felony, you can't get anything. So we try to get those people cleared and get them back into the workforce. Our number one workforce that always calling and looking for is UPS, FedEx, and some of the restaurant here in Douglasville. We have been very successful down there thanks to our great leaders here in the city who got me into it. I don't know why. That was Sam Davis. Brought me to the district attorney's office, one office I didn't want to ever go to. And that at that time, it was Matthew Fortner. He's now the judge. And he said, these guys just need a little
Brian
help.
Fortner.
Bradford.
Bradford.
Yeah, Judge Fortner.
Just need a little help out there, those guys on the street. So I just had retired. I didn't want to do anything really but have fun. And I got involved in it along with Matthew Cruel, teaching us how to do this, how to help get people record clean. Also, Sonia Compton, our great police chief, Gary Sparks, our great sheriff, Sheriff Pound. They all work with us diligent. Anything that we need and they can help us with, we don't have a problem within the system in doing it now.
That is wonderful. And how did you get involved, Kelvin?
Well, I'm working with Mr. Hooks 20 plus years at Martyr. And I always been that type of person that I've been a leader. I've been an advocate. I've always been outspoken. When he first came to me with this idea, I was kind of hesitant. But I must say I owe a lot of the work that I do, and God bless his soul, to Mr. Harry Sparks. When I first moved here, I was the first person I met. I met him at Mr. Davis' barbershop. And I'll never forget what that young man told me. I called him Uncle Tom. And he said, young man, he said, I want you to come to one meeting. And I went to that one meeting. And when I watched him perform and the respect that he gained, I had to go back to that barbershop and I had to apologize to Mr. Sparks in front of everybody. And I love that man for that because he instilled something in me. If you want your neighborhood to grow, you got to get involved. And I've been involved ever since.
And you have.
I
I
have.
can
That's
I
right.
can attest that you definitely have. So let's talk about mental health. We are not mental health experts,
Nope.
but we do know what mental health look like. And unfortunately, sometimes when you cannot touch or see a scar, it's hard for us to believe it. But when you have individuals such as those that you work with who have been combated over and over and over again with the penal system, what type of challenges do you see that how does it affect their mental health?
I think the system itself sometimes put us in mental health positions. And what I mean about that, during my time of coming along, we used to say that person is crazy. No, you can't say that because we learned something different. Mental health is real. I'm talking about showing up real. So when a person is like that, you can't put them in a cell. That makes them more violent. They need medical help. And what I mean by medical help, they need some guaranteed treatment. If they can't be on the street or something like that, put them in a hospital or something like that, that somebody can treat them for a time. You just can't go to the courtroom today and I violate something and you put me back in the system. All you're doing is repeating them. We say the jail is full and costing money. That's where the money's wasted.
Recidivism.
Take some funds from somewhere, drug money funds is particular, and put these people into some place like Georgia Region, somebody that can take care of them. Get them
So
off the street.
unfortunately, a lot of our mental health facilities are closed. So where do you refer them to? Because you hit the ground running. How often you open?
Well, we open, supposed to be on Tuesday through Thursday, but it got so heavy we went Tuesday through Saturday, and sometime on appointment. We call individual doctors or somebody we know that is not money hungry and say, well, look, we need just a little help. Give us a couple of days with this person. That's how we do it.
Because they can't afford it. A
They
lot
can't
of times
afford
they
it.
come to you, they don't have health care.
They don't have anything.
They don't have a doctor.
Right.
They just need some help.
On word of mouth, and our organization has built a reputation in Douglasville that we can call somebody like the doctors and the nurses that just left and say, look, give me a helping hand. If you can't give me a helping hand, make a recommendation where I can get this individual to. A lot of jobs has hired them. Popeye Chicken have hired them. Taco Bell. And they make good employees because they're what? Consistent in what they do. They just need something to do.
So do you all also, once you, let's say you have an individual come in, you do intake, because we make referrals to you all the time. You do intake, and then you help them through the process. Do you also follow them once they get a job? Do you check on them, and do you still
We
do
follow
that?
them
Oh,
through
yeah.
personnel. We don't go on a job like a probation officer and cause somebody to get terminated. Or
Right.
get somebody ran off the job. We check with them through personnel. We check them with the parents. We check through their family. And sometimes we just ask them those questions of sister and brother. And they're going to tell us. So we know
And you-
everything. Going in the
And
community.
you do the same thing, Kelvin?
Yeah, I mostly do the same thing, but what I have found out, a lot of the people that come to us, they be very, very discouraged with the system.
Why is that?
It's a lot of pressure when you're on 12 months probation, you're a convicted felony, and you can't get a job because won't nobody hire you because of your record. And the probation office is busy on these people about bring me the money, come report. The person never get into trouble, but when they get to the 11th month and they got 12 months probation, they get revoked because they haven't brought the money in. I find that's being a problem, especially in our area, because it's no job.
Right.
But they're being forced to go out there and commit crime because now our system is looking for a dollar sign instead of rehabilitate, trying to find a job replacement program for a lot of these people that deserves a second and a third chance.
So would you say that most of you, and I know that you are located in the New Horizons area, but would you say that the majority of your clients, would you say African American men, African American women, Latinos, Caucasians? What has been the largest population that you serve?
I would say that we serve a lot of whites, a lot of blacks, and a few Latino. Our barrier there is we can't speak Spanish and stuff like that, so we have a hard time. But we serve both sides.
So would you also say that we know who you are,
Right.
but I'm glad that we have you today here talking to our audience because more individuals will know that you're here. You're still kind of like a hidden secret. We don't want you to be a hidden secret because you do a lot of good work. And you're also located in the city of Douglasville. You use space at the city of Douglasville Community Center
Right.
on Hollis Street.
That is
I
correct.
commend both of you.
Thank you.
Also, Mr. Can you explain, each year Mr. Hook will bring someone in with health insurance, health care. Can you
Well,
talk about that, Mr.
yes, that's why I made the statement earlier about the minister has to get more involved. The first year that we brought a guy that we know, that I know from Marta, that I've been knowing him about 30-some years, that is honest with people. That's going to have to be accountable to me if you do something wrong or say something wrong. We brought in a guy that does the once a year Medicaid, Medicare, whatever you had to have. That first year we had a success. The second year we had a success. But what happened this third year is like, we was talking about the fruit and the vegetables and stuff like that. Well, the Medicare, some of the program, you can go to the grocery store and they put so much money on a card every month. This card was specifically say that you couldn't get nothing but eggs, apples, oranges, something like vegetable. So that was a guarantee right there for them, right? So this year wasn't a success because of COVID. We wasn't able to get out and get the word around. And a lot of time I had to add Teletoon in it because we call her for a lot of assistance.
They're
Sometimes
awesome.
for gas cars, sometimes for assistance on transportation or token. And she been, Miss Victoria Thomas, been very good with us.
Excellent resource.
That's where we get a lot of resources from. And that's also where we contact and she give us information to call somebody.
So if there were one comment as we close this segment that you want to say to our audience, but specifically to our African American audience as it relates to mental health and criminal justice, what would you say?
I would say mental health is real. I learned that because of my own family. That's number one. The criminal justice system got to change when it comes down to young black men. If I am a white male, 16 years old, and stole something at Walmart, I pay a little fine and go home. It may not go on record. But if I'm a black male, I go to jail. I'm on 12 months of probation. No job, no way to pay that. So then I become what you call a repeat offender.
And this is not something that you're just saying. You're saying
These
this
are
because
facts.
this is what you have worked
And
and
I
received.
invite anybody that would like to come on to 8304 Hollis Street, pull the drawers out and look for yourself. Last year in 2022, we got approximately, I'll say 75 or 80 people pardoned. These are people with murder records, burglary, and you name it, tough stuff. And you know that for yourself on a couple of them. We don't charge anything but a little minimum fee, help us pay the court costs. You have to go to court You got to pay for the paperwork. You got to pay for certified letters and stuff like that. Then there are some just don't have it.
Right.
And we said, don't worry about it. We don't get any funds. We'll take donation if anybody give us. The biggest donation we ever had is from Mr. Rainwater, that he seen something that was going on. And we didn't want no cash. We don't take no cash. He went to Sam's store, and we told him what we want for Thanksgiving. And he purchased approximately 70-some turkeys.
Wow.
For the
Sure
community.
did.
Yes, he did.
That's amazing.
Yes, he did.
So
But I would say also that anybody, any young black man from the age of 2 years old, because you can't have a record, from 2 years old to 100 years old, please come to us. We'll help you get straight as much as possible and get you into a good, decent job where you can get a job, housing, and take care of your family and pay your child support.
And insurance.
And insurance.
and your comments, Kelvin, as it relates to criminal justice and mental health, what comments would you say?
Well, mental health is real. And one of the things I had a bad experience because I had a neighbor that died. And I felt she shouldn't have had to die. But when it comes to the law, a lot of people are protected. They have mental health issues, but it's nothing that the law can do about it unless they have broken the law. We call so many times, every time the police show up, sir, ma'am, it's nothing we can do. He haven't broken the law. They can't make him take his medication. So it's something that as a community, this is a community problem. Because if you see something, you should say something.
Yeah.
We got to get more involved to find out how we can get some of these laws changed when it comes to insurance, getting people the proper medication. So many programs been cut when it comes to mental issues. It should be cut. On the other end, I tell all young guys, it goes back when I grew up, respect. Be humble. Be patient. Because if you do them three things, you can go a long ways. I don't have them but my reputation. And I would not let my integrity or my reputation go for anything. Because I'm a straight person, and I'm very, when I say I'm very determined to keep anybody held to whatever they supposed to do, I think the city councilman, Mr. Dave, I think the city woman, Sean, they'll tell you. I have came to them several times when I had an issue. If you ain't doing what you're supposed to do, I'm going to knock on your door.
That's right.
But I give them respect. Anything I have ever asked both of them for us to park or anything, they have always went out their way and made sure these kids had the right thing. And I thank y'all. Thank you dearly for serving our ward.
Well, thank you
Thank
for your
you.
comments. And, you know, I have to say, for these two
my.
gentlemen, they definitely speak from their heart and they're very passionate. Although they do assist individuals with getting out of trouble, they're proactive with helping and collaborating with our police department, our court system, and doing what is needed before you get
Amen.
in some
Amen.
trouble.
Amen.
So thank you so much for your time, Councilman Davis.
I just want to say I got a proclamation that we will be giving to JARS because JARS keep Holly Street clean, Warren Drive, everywhere. So we're going to bring a proclamation from you and I because they do a whole lot in our community.
Yeah, so we
Thank
do
you.
support you. Thank you so
Thank
much
you.
for your
And
time.
thank both of y'all.
And our listening audience, continuing moments in Black history for the year of 2023. This ends our segment for this year, and we will see you again next year.
We out.